Thank you for joining us for Patient Conversations with Leah, a place where patients and caregivers can talk with me about the real, relevant, and yes, even the raw aspects of their lung cancer journey. Because we want to know and understand these perspectives firsthand from those who are the true experts on what life is like for a young adult diagnosed with lung cancer. Tonight, I have the absolute honor and privilege to interview and also introduce you guys to Sydney, who I met at the World Conference on Lung Cancer. She has been on her journey a little bit longer than I have, I think 2 years longer than I have been, but she is one of the original young lung cancer patients before that was even really a term or a definition. So I would like to turn it over to Sydney, and Sydney's just going to give you a quick little summary of maybe her initial diagnosis and her initial feelings, and then we'll just kind of go from there.
Okay. All right. Well, so I originally started having symptoms like a year before I was actually diagnosed, but I was living in Jamaica at the time and I was still kind of just trying to get into residency. And I realized that I used to do a lot of 5Ks, and all of a sudden I just felt like it was getting more and more difficult to do my runs. The breathing just got harder. I felt like I keep saying this, I felt like I was huffing and puffing like an old man. And at first I thought, okay, maybe I'm just out of shape. But I eventually had to go and get an x-ray because I woke up feeling very tight on only the left side of my chest. And then, of course, that's where you have pneumonia, let's give you antibiotics. That's that one. Then after that, that's when I started coughing and I went to a pulmonologist and he's like, oh, you have hyperactive airway disease, let's repeat another x-ray. Granted, the abnormality was still very much present there, but it is what it is. When I moved to the States, I began wheezing and I went to see a pulmonologist up here, and she sent me to the allergist to get a battery of tests. I repeated a chest x-ray, and then the chest x-ray actually said small left lower lobe abnormality. And I went to her and said, I need to get a CT because I've had a left lower lobe abnormality for at least a year now, and that means there's something in my chest. So thankfully she listened to me and I got the CT. This CT showed the mass that was compressing my airway, and that was the reason I was wheezing, not asthma. So, of course, they're like, oh, we think it probably is something benign, maybe carcinoid tumor. We'll just go in and take a biopsy and, that will confirm what we think it is, because you don't have any risk factors, you have no symptoms. And when I woke up from the bronchoscopy, she had this look on her face that said to me, we found a friable mass. Now, friable in medicine means cancer. There is nothing else that is described as friable. So when she told me friable, I was just like, you are telling me I have cancer. And she's like, well, we have to wait for pathology because, again, they can't tell you point blank until they have the pathology to say it is cancer. But if it walks like a duck, quacks like a duck, it's a duck. And we all know it's cancer, but we just can't say it because we don't have the tissue confirmation. So tissue confirmation came back. And they referred me to a tertiary center thinking I was stage 1. And the tertiary center said, we're going to do all this all over again. So I did another bronch, came out of the bronch saying, oh, you're not stage 1, you're stage 3. Let's do a VATS. Did the VATS, came out of the VATS saying, we think it's still stage 3. So you're going to go to an oncologist, and she's going to give you some treatments to shrink the mass, and then hopefully we can do a lobectomy. If not, we'll need to do a pneumonectomy, which I was very much against. And in layman's terms, left side has upper and lower lobe, lower lobe. If you take the whole lobe out, that's a lobectomy. If you take everything on that side, that's a pneumonectomy. So very much did not see the point of taking up my upper lobe when my upper lobe was fine. But when I went to my oncologist told me, you are actually stage 4, which means that surgery is now off the table. That I have an ALK mutation, and that means that I would not need to do chemo or immunotherapy. I would take targeted therapy, but the targeted therapy I'd have to take for life. And they are teratogenic, i.e. toxic to a growing fetus, which means I cannot bear children. And I was in that appointment with my father and my boyfriend at the time, who we had discussions about future and kids and all that stuff. So to be told at 33 that I have stage 4 lung cancer, when I have always been obnoxious about my friends smoking and scolding them, and I have never touched a cigarette in my life, was the biggest irony of my life.
I feel you. I know exactly what you're saying. That's how I was. It's just, I told somebody the other day, it's like we heard the news and you could have knocked us over with a feather. I was willing to accept a cancer diagnosis of something other than lung cancer, I think, but the lung cancer was a shock. And you being so young, I feel so fortunate that I was 43 at diagnosis, and my kids were already born, and I didn't have to make those kind of choices or have someone make the choice for me. I can't imagine. I was diagnosed in 2019, and I remember it being so lonely. Like I didn't know anyone with lung cancer. I mean, I didn't even know that I could get lung cancer, much less did I know anyone with lung cancer. And just to find my way and knowing that I wanted to be an advocate so other people would know, I just didn't even know where to get started. And you started this journey 2 years ahead of me. And I'm just wondering, how did you figure out that you wanted to be an advocate, and how did you get started in your advocacy work?
That's a very good question. I think so. How I got brought into advocacy was that my oncologist asked me if I wanted to go to an NFL game. Chris Draft, who is another lung cancer advocate, he was bringing lung cancer patients to NFL games and using that to show, anyone can get lung cancer and the different phases of lung cancer. And when we started talking, Chris is very much about how can we push this forward. And I guess what I said piqued his interest. So he invited me to the National Lung Cancer Roundtable that was later on that year. And when I went there, I met quite a few people, including Laurie Ambrose from it was Lung Cancer Alliance then, but later on now it's GoTo. So then I started talking to her, and then that's when she told me about Lung Cancer Alliance, GoTo, about like the Hill Day, and then that's how I got invited to actually speak at the Hill Day. And that was actually my first advocacy kind of launch, going to Capitol Hill, talking to, these representatives. And of course, I was the youngest there. Everybody there was in their 50, well, I would say probably older than that. I felt like everybody there was like 60s, typical age that you think of so of course, being the young buck, the person who looks different, they were like, oh, your story is compelling, you talk. and they just pushed me to talk. So every meeting we went into, they were like, oh, and we want to tell you about Sydney. And I think just being pushed and just realizing that, I think also what really annoyed me was there was no one who looked like me there. And it was like, I always felt like, why do I have to be the youngest person here? Like, why did I have to draw this short end of this stick? Like, so I'm sad when I see people who are close to my age now, because I mean, this is not a club that anybody would want to join. But at the same time, it feels less lonely for me because, you know, when you're older, you've gone through certain things, you've built certain things. When you're young, you're just starting I was just starting my career. I was in training. So I, didn't have resources. I couldn't even take FMLA or disability because I had literally just started my residency program in June and I got diagnosed in February. So I had to continue working. Otherwise, no insurance, no meds, no meds.
No
Yes, 6 feet under.
right. Yeah.
So yeah, so it's like it's different, and a lot of people don't necessarily understand that because they're probably older, they have retirement funds, they've already bought their house, and all of these other things. And for me, I was like, okay, I don't have any resources. I can't not work. And I used that to kind of fuel me, to kind of push me forward. So my aim was, okay, you are going to graduate residency, and you're not going to go to fellowship because 3 more years in school where you don't know how life is going to be does not make sense. But I am thankful that I was able to finish residency without any issues, and I'm able to work. And all of that is because of research and targeted therapy. And I think that's also something that really fuels the passion that I have, because to imagine I got diagnosed with stage 4 lung cancer and I was able to continue internship, continue residency. And as much as everybody thinks, oh yeah, residency is hard.
I can imagine.
Right? And you do all of that, and I'm still able to graduate on time. I'm still able to work, and that's because of modern medicine, because of targeted therapy. And that is one of the reasons why I continue advocating and pushing for more research and just for awareness, because treatment is great, prevention is so much better. And everything is about smoking, which, I mean, yes, I understand smoking is the number 1 risk factor, and most lung cancers are related to smoking. But when you have a subset of patients, almost 20%, who don't have that traditional risk factor, and those ages are getting younger and younger and younger, at what point do we wake up and say, okay, we need to invest more money into researching the whys behind what is the cause of lung cancer?
Yes, I agree. Now, when we were talking about this is something I think about all the time. Like, how did I get here? Even at 43, like I didn't qualify for any of the screenings because I had never smoked. I didn't grow up around secondhand smoke. I wasn't 50,
Mm-hmm.
all the things.
Mm-hmm.
So it's like almost like how, I just am interested to see what your opinion is, being that you're a physician. Is it that we need to push for early screening? Like, should that be our next thing, is let's get people qualified to screen, even if you haven't smoked, like change the screening criteria, do you think? Or do you think it's more of, let's focus on progressing research and medication so we can study this group of people that are young and what's causing it? Like, maybe it's just the part.
So, I mean, I think that, I've gotten into many debates about expanding the screening criteria. And everybody's always like, oh, it's all about the fact that, there's more risks, and we're going to be, chasing down more benign nodules, and, that this, it probably should be limited. And I hear that, there is definitely an increasing cost to screening everybody. But at the same time, I think that, the cost of getting diagnosed and the cost, I mean, when you think about the cost of these medications, the cost for my drug is like $17,000 per month. At what point do you realize that doing probably a low dose CT is less than that? If you catch a cancer early, the cost to the patients, the cost to the insurance, the cost to the workforce, because this person is not having to go on disability, the person is going to be able to be productive and actually go to work, is so much that it makes more sense to do it. I do think that that's likely not going to happen right away. I think what they're going to have to do is we're going to have to do more research into figuring out what are other risk factors, and then using those risk factors to help to expand the criteria. So, I mean, everybody knows that radon can cause lung cancer, but there's no true robust screening, in terms of like, there's no legislation about having to screen your homes for radon, or any sort of mitigation sort of criteria or anything to that degree. So I think that once we know more risk factors, then that will help with the expanding of the screening criteria for now, because it's a lot of resistance that we're getting about expanding it.
Yeah. I see both sides of the coin. And, speaking of like the cost of having the stage 4 lung cancer, and, I know when I was diagnosed, I don't know if you heard statistics or not, but, the first oncologist that saw me told me I had 6 to 12 months to live. Then the second one told me I had 2 years once they found out I had EGFR, so that I had a targetable mutation. So when I started my targeted therapy in 2019, December of 2019, the sticker price on Tagrisso was like $15,000 if you didn't have insurance, just flat out $15,000. And a couple months ago, probably within the last 6 months, I got a bottle of Tagrisso, comes in the mail, and the lady from the pharmacy called and she goes, I don't want you to freak out when you see the sticker on your Tagrisso. She's like, normally it says, you owe zero. She's like, we're having a computer glitch and it's going to tell you the full price of the Tagrisso, but don't worry, you don't owe anything. And I was like, okay. And I opened it, and now it is $36,000 for 30 pills if I did not have insurance. And I don't know about you, but I mean, I feel blessed because I have health insurance, and then AstraZeneca has a patient like care team that will like offset costs for people. But this causes major financial toxicity to the patient, their family. I know you probably have lots of thoughts on that. And you kind of talked about how you didn't have an option not to work. So kind of, what was it like when you were first diagnosed and getting into this and thinking, especially since you're a doctor, thinking about all the things that were going to cost money and, missing work for appointments and, your co-pays and this, that, and the other. And how has that affected your life and like what you had planned before your diagnosis?
So, I mean, honestly, when I got diagnosed, I think that I was probably more so shocked about the diagnosis that the financial aspects of it wasn't top of mind initially. And then afterwards, my friend who, she is American and she knows the healthcare system, was like, this is going to cost a whole lot of money. Let me put together a GoFundMe for you. And it's funny because it's kind of normal now but back then I was one kind of not very familiar with GoFundMe's. I've heard of it, but never really, paid it much mind. And two, it kind of seemed like, oh, I'm going to go and beg people to give me money. Like, what? So of course, initially I was kind of resistant to it. Then eventually when, things were kind of not really, it was very fuzzy, she said, you know what, Sydney, I don't think that you really understand how much this can cost. So she really kind of wrung my arm and we finally put it together. And then I told her to pause on it though. And then when we found out it was stage 4 and not stage 3 that we thought it was, she was like, well, I'm putting this out. And she sent it out. And it got quite a bit of response. A lot of response that I was not anticipating because, I was now in the States and I'm thinking, this is my friend in the States. And what ended up happening is somebody who I guess is in both of my networks, in terms of my American network and my Jamaican network, he got the GoFundMe and he posted it on his Facebook, and then it erupted in Jamaica and everybody found out, and I wasn't prepared for that. I got a whole lot of outpouring of love, and I definitely got some, money in that regards. But I think really what it was more so just everybody's cumulative shock and bombardment of a lot of questions that I just couldn't answer. But I think that between the insurance that I had in residency, which was surprisingly very good, and the GoFundMe, I was able to cover, like my co-pays and, my medical expenses and that sort of stuff. So I didn't really have, thankfully, a lot of toxicity at that point.
Yeah, because I can't imagine being single and 33 and taking on those kind of expenses. I was a teacher at that time. Well, when I was single, I was a teacher and our insurance was terrible. And I would have never been able to, I would have had to have my parents help. There's just no way I could have done it myself. So I often think about that. As we're talking, I've thought so you've done several different types of advocacy work because you've done things with GoTo and STARS, correct? And whatnot. If you are I'm just kind of interested and curious to know, what's your goals in advocacy? What would you like to do next? Or what are you working on now? Or what do you want? What would be your ultimate advocacy if you could do it?
Good question. I think really what it is that initially I was more so talking from the patient's perspective, talking and, kind of like, guys, lung cancer is not just an old smoker's disease. It's not just somebody who's in their 70s. I am a face of a person who has lung cancer. And it was really more so of bringing awareness to the younger faces that have lung cancer, and the fact that there's so much uncertainty and questions about why people get lung cancer, because I didn't smoke. So why did I get it? And I am from a country where everything is pretty much exposed and, we don't really have basements. So I doubt it's radon exposure. So why did I get lung cancer? And 3 years after I got diagnosed with lung cancer, my aunt got diagnosed with lung cancer, and we had never been in the same environments. She got diagnosed with EGFR exon 20. I have ALK. So it's not even like it was the same mutation. So clearly, maybe we have some susceptibility to lung cancer, but, of course, no one knows because no one has researched it. So I think that was really, originally, it was more so bringing awareness to young lung cancer, because there weren't that many faces there. Now that we have more of those spaces, and I feel like I can hand the baton to other people in that space, I feel like now that, I have medical background. I did biochemistry in undergrad, and I did research. That now it's more so, how do I help to push the research forward to kind of let them know that from a patient perspective, we need more. So I am definitely heavily into like advocating for more research money, which is the reason why I go to every year to Capitol Hill. I definitely am about, trying to get more people to do research and do, research grant reviews and that sort of thing. So I think that's where I'm kind of gearing towards now. But I think it takes a lot of resilience and perseverance to go through this diagnosis. And I've been, called those things so many times over. And I think that for me now, I enjoy not only share my story, but also trying to give people, some hope, and to let them know that, a diagnosis like this is not the end of the world. It's not, oh my gosh, I'm going to die tomorrow. I think that doctors are not God. They're not fortune tellers. Yes, there are certain instances where we can tell that the end is near. But if I'm walking into an office and I'm just getting a diagnosis, a doctor should not be telling you, oh, you only have 3 to 6 months to live. No. Not with the therapies that are out there now.
Yeah, I definitely agree with that. I just, it's just really surreal. Like, how I feel like, 2017, 2018, 2019, 2020, definitely with COVID. Like, I don't know if it was because of COVID that you didn't see young people standing up and saying, hey, look, I've got this too, or, I've been diagnosed. I feel like when I was first diagnosed, I felt like there was such a stigma around lung cancer that I can remember telling my husband as I'm laying in the hospital bed being diagnosed, and he was on the phone with attorneys in, up Northeast, and we're in good old Kentucky, and everybody thinks Kentucky is, either Derby or barefoot farmers, one of the two. And he's telling these people on the phone, oh, my wife was just diagnosed with stage 4 lung cancer. And he got off the phone. I said, Todd, don't ever tell anyone that again. He said, why? I said, because they're going to think that I've smoked my entire life. That was like the first thing I thought of. And it was like that stigma. And like every time I went to tell someone, or someone asked, and I said I was diagnosed with stage 4 lung cancer, the first words out of their mouth were, how long did you smoke? I didn't know you smoked. When did you quit smoking? So I think now maybe some of us original OG young lung cancer patients have kind of busted that myth a little bit. So now more people feel like they can tell their story and share their diagnosis with people. And I don't know about you, but like when I look at these people who are first diagnosed, they're, I can remember that like desperation of, oh my gosh, what, where do I do? Where do I go? And my heart just breaks for them, because I know that feeling of just complete like disbelief and the darkness that at first. And like you said, being the hope for these people, I think is what all of us need when we're first diagnosed, is hope. If you were talking to someone who was newly diagnosed and they wanted to become an advocate, they wanted to get, into advocacy, what would be your advice to them as someone who's kind of led the way for advocacy for young lung cancer? What would be your advice for them, or where would you tell them to be started? I guess get started.
I think that advocacy has to be more than just you. So the first thing I would say for someone who is just diagnosed, get into the community, go and join the groups and get to know other lung cancer patients. Because if you are new, then you don't have much experience of being a patient generally. much less the OG patients can tell you, different things. They can tell you their situations, and you can use that to add to your stories when you're trying to advocate by referencing your friends. Like, I can reference the fact that right now, Aurora is talking about fertility, and I went through that issue myself many years ago. I mean, at this point, I have accepted, but I went through the stage that she went through. So we can have that sort of discussion, and she can ask me how I dealt with it. I think that advocacy is about the community, It's not just about, oh, I want to show my face and it's more so I'm talking for a collective group of people, and the only way to do that is if you know the collective group of people.
Right.
So joining the networks, that sort of thing.
Yeah, I agree. So when you were talking about community, this made me think of a particular person, but an experience I'm sure you've had as well. So when I was first diagnosed, like I said, I didn't know anybody that had lung cancer. And one of the first people that reached out to me was a girl named Elizabeth Moyer, who you may have met. She was ALK positive.
Mm.
She was diagnosed at 28 years old, or 29 years old. I'm sorry, 29 years old. And it was 6 months after she had her second baby. So she at the time had a 2-year-old and a 6-month-old. And we were 13 years difference in age. Definitely I was the older one. But we had so much in common. We both went to Catholic all-girls schools. They were rivals. Our parenting philosophies were very similar. Like, I don't know. Immediately we had a lot to connect with. We knew a lot of the same people. And she and I became very, very close friends. And unfortunately, she passed away 2 years after her diagnosis. And so for me, I think another big driving force in this community, in this advocacy, is fighting for those who didn't have the chance that I have. And I'm sure you, being in this longer than I have met people and then lost people. And I don't know, how do you think that affects the way you look at your life, your diagnosis, the way you advocate? Because it definitely changes you.
Yeah. I've lost quite a few friends. I lost my aunt. It definitely makes me grateful. I am grateful to have had, yes, I've had ups and downs and hiccups. I've had progression. But my course has been so tame compared to a lot of people, and the overwhelming thing I have is gratefulness. Like, I'm grateful for my journey. I think that when I go into like my ALK group and I see new people coming in, like, I'm always heartbroken that a new person has to join, especially when they're younger. I mean, not to sound partial, but it's like, if you're young, you haven't fully lived your life yet. And to kind of have this come and rob you, and that you're going to get robbed of, at least 20,
Something.
30 years, and that's a minimum. It's kind of sad. And when I see them run through the medications, like, it breaks my heart. I know that, like, there are a couple of them that for some reason I don't know them and I attach to them, and like, I'll watch their stories and I'll see it happening, and I'm just like, and I think for me, it's what pushes me to continue doing what I do, because I know that not everyone will be as fortunate as I am. Not everyone will be able to have the energy to go and do the advocacy that I do. And that's one of the reasons why I say, advocacy is not just about you, it's about the community. You're representing people who can't do what you're doing. So it's about learning from everybody
Mm-hmm.
and putting that forward to say, hey, I have a friend who has this problem. I have a friend who has that problem. I have this problem. You guys need to pay attention to these side effects, or, you need to make meds that counteract this, or, something to that degree. It just, it just breaks my heart when people have their life just ripped out from underneath them for no reason.
Almost like my diagnosis has been a rebirth in some ways. Like, I don't take anything for granted. I celebrate all the birthdays. Like, I'm sure before this, I would have thought, oh, 48. Who wants to be 48? I'm like, bring it. I hope I make it to 50.
Oh,
60 sounds great. Like, come on.
yeah. Before, I hated getting older. And then I was like, oh, 40? I am
Bring
going to
it.
celebrate. I am going to Bali.
Yeah.
Like,
Yeah.
you celebrate the wins.
So, in a way, this is the worst thing that's ever happened to me, obviously, but it's also, I don't know, a gift that I've been given it in an odd way, that I can now appreciate the simple things. And like when my 14-year-old says, Mom, will you just lay down and snuggle with me for 15 minutes? How am I going to say no? It's like, before that, I know, because I had a 14-year-old before I was diagnosed, you're so in the rat race of getting everything done that you can blow those things off. But now it's like, I don't know, it just changes your whole perspective on life. And I think your empathy for others, your compassion, I'm sure, I always said having kids makes you a better teacher. I'm sure having your diagnosis makes you an even better doctor, just because.
Yeah, because you know what it's like to be a patient. I've had patients that I don't tell everybody my diagnosis, but I've had some patients that I feel if they're struggling, then I tell them. And, during the pandemic, pandemic does a lot of things, but the pandemic for me, it pushed me on the oncology floor, dealing with oncology patients every time I went to work for 2 years straight. So for me now, I was now taking care of patients who had a kind of cancer diagnosis and seeing all the things that happened with them, or even just patients who they're just now getting diagnosed with cancer and they're going through that turmoil of emotions. And for some of those patients, I told them my diagnosis just to say, hey, it's okay. Like, I'm here standing in front of you being your doctor 7 years or 5 years, however long that was at that point in time. But, it was kind of like, I'm here. Like, life can go on. Like, it's not just, oh my God. Yes, it's serious. I'm not going to downplay it. It is serious. But I think that a lot of people need to realize that it's okay to cry. It's okay to let those emotions out, but don't sit in that corner and wallow. Don't stay there. Like, you need to pick yourself up and you need to say, okay, I have this. How am I going to deal with this? And, try to push through it and be positive. Like, it's kind of hard to say be positive about a diagnosis such as this, but just as you just said about the fact that it kind of changed your outlook, like, my cancer diagnosis changed mine. I kind of say, if it doesn't pass the gravestone test, then it's not that important. And every time I say that, they think it's morbid, but I'm like, look, on your tombstone, they're not going to write you're a great doctor or a great researcher or you were a great lawyer or all this stuff. They're going to talk about your relationships with your friends, your family, right? Your other community, like, they're going to talk about your politics, and they're not going to talk about your job. They're not going to talk about how much money you have or any of those things. So those are the things that are important. Your friends, your family, spending time with people who you love and who love you, and also making a difference for other people so that they don't have to struggle or go through the struggles that you had to.
Sister, I think you're saying the right things. I feel you. I agree. I know it's just so crazy. And I just feel so really, truly blessed to have met you, to meet the other survivors. It's just, I don't know. It's a crazy, crazy diagnosis. It's something neither one of us, any of us ever would have expected. But there's such almost like I don't want to call it a sisterhood because there's men too, but it's a club that nobody really wanted to be a part of. But then once you're in there, the support is tremendous, and you just meet some of the best people and the smartest people. And
then you also realize that everybody is coming from so many different walks of life, and even that is a learning experience in itself. Like, I mean, definitely there are many personalities in lung cancer, so I'm not going to say that I like everyone, but I mean, for the most part, you can come to understanding with most people, and you can kind of recognize, why they are the way they are. And I've never really had bad interactions in any lung cancer space that I've gone into, which is, totally different from other spaces. And I think because all of us know that the ultimate goal really is so that we can get better care. So everybody's going towards the same goal.
right, right. No matter which biomarker, or if they don't have a biomarker, if they have a smoking history, if not, we all want the same thing. We all want good quality life and as much as life as we can get. So I know we have kept you so long tonight, and I really, really, really appreciate you doing this. I feel like there could be a part two. I feel like there's, like to be continued here. But you are just a light. You're a breath of fresh air for everybody. I know sometimes it's hard to put yourself out here like this, and you've opened up, and I just can't thank you enough for doing this tonight. I just think what you have said, and being that you're a physician, it gives you both sides of the coin. I think people are going to learn so much from you. And I just thank you for all you do. And thank you for the advocacy you did, because indirectly it's affected me too. So, and every single one of us in this space.
Oh, thanks.
You're welcome.
That actually, that makes me feel good for today. Okay.
Good.
I'll take it. Definitely. Thank you.
You're welcome.